we will be addressing and debunking a lot of myths surrounding COVID-19. Myth number 1. COVID-19 vaccines will affect their ability to carry out their exercise routine after receiving the vaccine. Fact. COVID-19 vaccines can cause mild side effects. Most people can return to exercising within days or even hours of getting the vaccine. Myth number 2. COVID-19 vaccines can cause infertility. Fact. There's no evidence that COVID-19 vaccines can cause infertility. Myth number 3. If you've already had COVID-19 and have recovered, you don't need to get the vaccine. Fact. After getting COVID, people do get an immune response, but it's recommended for people who've already had COVID to get the vaccine. This is because the vaccine serves as a boost to the immune system, and this, in turn, makes a secondary COVID infection much less severe. Myth number 4. You don't need to wear a mask after getting the vaccine. Fact. COVID-19 vaccines aren't 100% effective. You should still wear a mask and avoid large crowds after vaccination. Even though you are vaccinated, it does not stop you from being infected with COVID, hence why we need to wear masks. The vaccine will only reduce the severity of the complications. Myth number 5. The COVID-19 vaccine can give you COVID-19. Fact. The vaccine will not give you COVID. It does not contain a live virus. Myth number 6. COVID-19 vaccines aren't safe and were rushed for use. Fact. COVID-19 vaccines are safe. All vaccines go through safety testing before they're approved for the public, and this includes them going through phases 1, 2, and 3 of clinical trials, as well as getting approval from the WHO. Many smaller independent studies are also done, and all of them are concluded with the support of the vaccine. Myth number 7. The current COVID-19 vaccines don't protect against the COVID-19 variants. Fact. Research suggests that COVID-19 vaccines are slightly less effective against the variants, although these vaccines still appear to protect against these variants from developing into a severe COVID-19. Myth number 8. COVID-19 vaccines will alter my DNA. Fact. COVID-19 vaccines won't be able to alter your DNA. Myth number 9. I'm allergic to eggs, so I shouldn't get the COVID-19 vaccine. Fact. Vaccines made by Pfizer and Moderna did not contain eggs, nor were they used in the development or production of either vaccine. Myth number 10. COVID-19 vaccines cause severe side effects. Fact. Reports of serious side effects are exceedingly rare. For Pfizer and Moderna, you may experience some mild side effects like pain at the injection site, fatigue, and chills. However, these symptoms get better without any medical care. Myth number 11. The COVID-19 vaccine was developed to control the general public either through microchips or nanotransducers in our brains. Fact. There is no vaccine microchip, and the vaccine will not track people or gather personal information into a database. Myth number 12. Pregnant and breastfeeding women should not get the vaccine. Fact. Research suggests that getting the COVID-19 vaccine during pregnancy poses no serious risks for the mother or their babies. Myth number 13. The survival rate for COVID-19 is high, so you don't need to get vaccinated. Fact. We must protect our vulnerable and at-risk populations. Also, while many survive COVID-19, they have continued effects on their health. Thank you for watching our video on vaccination myths.